Nursing homes have been the scene of many of the coronavirus outbreaks in our community. So our David Lippman spoke to the head of the state's biggest nursing home association to find out what's made them so hard to protect and what needs to happen to prevent even more cases.
There are constant stories on the news about COVID-19 outbreaks happening inside the restricted setting of a nursing home.
And the center says 1 employee and 5 residents have died due to the virus.
Nearly 40% of all COVID-19 deaths in Texas are linked to long-term care facilities.
Within the long-term care communities, with communal settings, there is a lot of interaction, obviously, because these are residents that require 24-hour, 7-day-a-week care.
Kevin Warren with the Texas Healthcare Association says long-term care facilities are trying hard to isolate residents who are sick, but that puts a real strain on a supply of personal protective equipment that was limited to begin with.
Candidly, it's been a struggle. That's why we've been asking and speaking to state agencies and elected officials and others for a couple of months now.
Making sure employees can keep themselves and their residents safe is the big challenge nursing homes face. But there isn't a quick fix. The financial cost of the virus and a staffing shortage have Warren thinking the industry might need federal stimulus money.
This was an underfunded profession beforehand, and the increased need for PPE, for testing, for staffing, just further puts additional cost on these providers. And so we've got to make sure that they have all the necessary resources.
The other thing he believes would help is more interaction from all of us. In-person visits have to wait, but cards and videos for the residents and their caregivers could create a few smiles during a very stressful time.
These providers within these buildings, they're being stretched, but their residents and others' loved ones, they matter so much to them that they're doing everything they know to do so that we can get through this and so that we can look back and figure out what do we need to do differently moving forward.
We've got you covered, East Texas. David Lippman, CBS 19.